Well, all right, so it's 2:01. We'll go ahead and start. This session's being recorded. We're going to upload it to YouTube when we're done. So we'll answer the questions that we did this morning, and I didn't get any new ones from this morning's session. So Emily, I don't know if you did, because I said they could email you too.
No, I didn't get any new questions.
All right. So we're going to go over all of the same information. And if you have questions, we'll have plenty of time to address anything new that comes up. Primary focus or primary topics really are the COVID-19 vaccine, especially the mRNA vaccine. Emily will touch on the Johnson & Johnson vaccine because it is a different type. How the vaccine works, kind of how immunity works, the theories behind why the vaccine would affect fertility, which it doesn't do, how it impacts or could impact pregnancy, and some of the ingredients in the vaccine and the variants and the effectiveness of the vaccine on these COVID variants. So, starting out, just kind of a little tidbit on how the mRNA vaccines work is Moderna and Pfizer have created a 2-dose vaccination series using mRNA technology that delivers a small piece of code or messenger RNA for the spike that's on the COVID cell, so that our body's immune response, or our body responds by developing antibodies to that spike protein when it's either injected or then subsequently when we're exposed to COVID. And that spike protein on that COVID cell is actually what attaches to our own cells and allows COVID to replicate and make us sick. So if it can't attach, it can't replicate. Basically, it's a pretty simple concept, and there's a lot of concern going around over the fact that this is new technology or that we've only had this technology a year and all of a sudden we're supposed to get these injections. But this technology has actually been in development for over 30 years. We have used it successfully, not necessarily to vaccinate, but in trials, it's been successful at treating certain types of cancers, especially skin cancers. There's an active trial right now for that. And we started working on an mRNA vaccine for coronavirus back in 2001, I think, is when we had the first SARS concern. So this technology isn't actually new technology. It's just the first time these big pharma companies haven't had to develop a vaccine essentially altruistically. They've had all of the resources and all of the money to do this as quickly as possible. So that's why we got the vaccine so fast. It's because we had the technology. We have known about the technology for 30 years. We have been developing specifically a coronavirus vaccine for the last 20 years. And that's why we were able to roll it out so fast. So it's not that it's brand new and there's brand new technology that we're just asking you to inject into your bodies. It is pretty old, pretty safe technology that we're using.
Yeah, in the early 2000s when SARS and MERS, Middle Eastern respiratory syndrome, came into play, those are both types of coronaviruses, and that's when this technology was really starting to be used and looked at to create a vaccine. Luckily for those people who were ill with those things, those viruses kind of quickly burned out. So there was no need for a vaccine. So all of the research that had been completed just kind of got filed away, put on the back burner until our new SARS-CoV-2 or COVID-19 coronavirus showed up. So all of that education and work and research had already been completed for those other two similar viruses, 20 some years ago. So that's one of those reasons that things happen so quickly, because if you've done all the research and you've done all of the studies, but then you never have to use it or implement it, you just put it away until we needed it, which is luckily for right now, it was available.
So one of the primary questions that we have been asked about the vaccination, or really they kind of center around each other, I guess, is does the vaccine have an effect on fertility, and is the vaccine safe while pregnant? And then a spinoff of that is the vaccine safe to use while breastfeeding? And of course, those questions are prevalent and common in our population, our staff population, because a lot of our staff are of childbearing age with children or breastfeeding children. So essentially, back when we did a Q&A in January, research in the American College of Obstetricians and Gynecologists said, yes, we believe this is safe and pregnant people should get the vaccine. There were DART studies completed on the toxicity of the vaccination in non-human test subjects, and those studies didn't show any concerns. Now, 6 months later, we have a whole database of pregnant individuals who have been vaccinated, or vaccinated individuals who have then become pregnant, and we're able to use the thousands of people that have voluntarily submitted information into the system to conduct research and ensure safety. And we have the information now that says, yes, this is safe. It's safe for people who wish to become pregnant. It's safe for people who are pregnant, and it's safe for people who are breastfeeding. And Emily will go over the breastfeeding components in just a little bit. She's done a lot of research on that. As far as the fertility question comes up, because it's pervasive, it's been turned into memes, and it's really spearheaded like a violent reaction from people on social media. So I kind of want to just go over the history of that and explain why this even is a thing. So we talked about the spike protein on the outside of the coronavirus cell, and how we created the mRNA vaccine, or how we created vaccinations that would target this spike protein. And some genome sequencer, they used to work for a pharmaceutical company, and it was absolutely the right thing to do, is to say there is a very similar spike protein that develops in a placenta. We need to know if the mRNA vaccine is going to target this spike protein because it's similar to the spike protein on the COVID cell. So it was absolutely correct information, and it was a theory that definitely should have been studied. The fact that it was studied is a good thing. The fact that we've now debunked this several times over, the spike protein on the COVID cell and the spike protein in the placenta are not anywhere near close enough for the immune system to get those two confused. So our immune system, if we develop antibodies towards the spike proteins towards COVID-19, our immune systems are wonderfully developed, very good at detecting the specific viruses and ailments that it's targeting. It's not going to get confused by the two proteins. Therefore, it can't affect fertility. There was an editorial done in the New England Journal of Medicine. Editorials aren't really necessarily evidence-based, publications, but the New England Journal of Medicine, I read a lot of their stuff on the COVID vaccine. They seem to have a good handle on it. And one of the scientists studying this said that your immune system confusing those two spikes, those two spike proteins, would be essentially analogous to you walking into an alley and seeing a gray cat and thinking it was an elephant because they're both gray. That's the similarities there. You're not going to think that a cat is an elephant because that's just not how life works. So essentially that's the message, is that it can't affect your fertility. It's not going to. And it's not going to affect pregnancy for the same reason that it's not going to affect fertility. There's not toxic substances really in this vaccine that could damage a pregnancy. And the thousands and thousands of people who are now pregnant and have been vaccinated, or who were vaccinated and subsequently became pregnant, the rates of birth complications in vaccinated people are exactly the same as the rates of complications in not vaccinated people. The spontaneous abortion, infant, pregnancy loss, low birth weight, all of those complications, the COVID vaccine has not had any effect on those. The rates are exactly the same, and in some cases improved in vaccinated individuals versus unvaccinated individuals. And there could be some reasons for the improvement in those outcomes in the vaccinated individuals. And it could, it's more likely that people who are getting vaccines are more health conscious, which would also improve the health of the pregnancy. But that needs more research before we can make those determinations on the whys. We're going to talk about breastfeeding.
So there were some concerns about if I get the vaccine, if I wait until after I'm, have my baby and then I get the vaccine, is it still safe to breastfeed? And the answer is yes. There are only 2 vaccines that are contraindicated in pregnancy or lactating moms, and those are smallpox and yellow fever, 2 presumably eradicated illnesses worldwide. And the reason for that is those are live viruses in the vaccine. We give people a large amount of that, not enough to make them sick, but enough to be a live virus. So that's why those vaccines aren't recommended during pregnancy or lactation. So it's similar in the way that when you nurse a baby, when women nurse a baby, we do that because it's, it's really healthy. They get the antibodies from the mom. They want to protect them during those first few weeks of life. That colostrum milk right after birth is super important because of all of the nutrition and the antibodies. It's the same instance here. So if we give you the COVID vaccine, your body begins to replicate those spike protein antigens and builds up that antibody. So that if you're ever exposed to COVID-19 again, your body says, hey, I know what this is, I know what to do, and I'm not going to get sick because I already have this antibody in my system. So those antibodies that you have created are expressed through the breast milk, and they essentially provide the baby with that protection from COVID-19 the same way it would if you got a flu shot or a tetanus shot during your pregnancy or a pertussis shot. Your body metabolizes the vaccine, changes it into those good antibodies that keep us from getting sick, and passes it on to the newborn. There's a couple of different kinds of immunity, and this is important for people to understand, is there's an active immunity and a passive immunity. And active immunity, people develop active immunity when they actually get sick with an illness. So if I have the chicken pox and I get sick and I got bumps all over me and I have a fever, I have active immunity to the chicken pox for the rest of my life. In most cases, some people get a mild case and then they might have it again. But for the most part, if you have ever had measles, it's a once in a lifetime illness because your body replicates those antibodies and knows how to fight it off. That's why being immunized is so important, so that we can eradicate things like smallpox and polio and those types of things. That's an active immunity. A passive immunity is just that. We pass the immunity from mother to child. So the child was never sick, but they're going to get the benefit of being immune because the parent was immune. So if the mom gets the flu shot during her pregnancy, some of those antibodies are going to cross the placenta and in turn help the baby to be immune against whatever that vaccine was for. The theory is the same for the COVID vaccine. It can cross the placental barrier and it is expressed in your breast milk, but it doesn't last forever. It's not like if you got active immunity from an illness that you're going to have forever. Passive immunity is going to wear off after time. That's why nursing a newborn baby and getting those first antibodies is so important for the baby's overall health. Where did I just go in my brain? So the baby will have some immunity, at least for a little while, until their immune system develops fully, around that 6 month to a year period of time when vaccines are, given and things like that to the baby. So that's important to know. And somebody said, well, I don't know what's in the vaccine. I don't want to pass that on. The baby isn't getting the vaccine at all. The baby's getting the antibodies only. You get the vaccine, it's injected into your muscle, your body does all the work. It metabolizes it, it learns the protein, and it starts to replicate those antibodies so that you don't get sick. That's what gets passed on to the baby, not the actual Pfizer drug or the Moderna drug in that type of an instance. So it's really important to know that you're not excreting any chemical or pharmaceutical component like that. One of the studies I read, when the mom got the first shot, after the first shot, there was very, very low levels of excrement in the breast milk, if any at all, because your body's busy at that time making those antibodies and starting to develop them. After the second vaccine in the vaccine series, the antibodies in the express breast milk did spike, and that's what we would normally expect to see, because your antibody levels in your own body are going to go up, and you're going to excrete those in the breast milk. The Johnson & Johnson vaccine and the Moderna and the Pfizer, the Johnson & Johnson's a little bit different in the way that it's made. And most women who are of childbearing age wouldn't be recommended that Johnson & Johnson vaccine be given, just because of the type of vaccine it is.
I think the information from the American College of Obstetricians and Gynecologists is that it's not recommended to get the Janssen vaccine. It's recommended that pregnant women be counseled that there are other vaccines available.
Okay.
Which we interpret to mean you should probably get the mRNA vaccine if you're pregnant. So that's just
yes. So the Johnson & Johnson vaccine is constructed differently. It doesn't use the mRNA or the spike protein. It's constructed like traditional vaccines. The flu vaccine, they take the actual COVID virus, it's destroyed. They use that inactive or dead virus to inject into the person so your body can recognize it and make those antibodies, just like it does with influenza or tetanus or any of the things that we get vaccinated for on a regular basis. Those are traditional types of vaccines that actually use actual virus strands. mRNA vaccine doesn't use actual virus strands. Like Mallory said, they're able to copy and identify the little bumps or the spikes on the outside of the virus, and that's how they're able to replicate that. So there's no biological material in an mRNA vaccine. There's no,
There's no actual COVID in there.
no, or cells or human cells or anything like that. There's a lot of misinformation on the internet as far as what goes into the vaccine, which kind of leads me to my next question. Somebody asked, well, what are the ingredients in the vaccine? Because I heard that it has, you know, this or that in it, or it's just sugar water, or there's not anything really in it. It's full of chemicals and preservatives, and I don't want to take that in my, put that in my body. So I looked, I had got the breakdown from Pfizer and from Moderna and from Janssen, and was able to see the mRNA vaccines are essentially the same. They have a fat in them, a lipid source, and that lipid is there essentially to hold on to the mRNA. They need something to be able to carry those spike proteins into the person receiving the vaccine. And this is how they can do it. The lipid is it's a thicker kind of substance. It's, well, it's fat. Lipids are fat. So it's got that nice greasy exterior that helps the mRNA slide. Like that's actually what it says, that it helps it slide into the cells where it's going. There are things like salts, sodiums, and this helps balance out the acidity in the vaccine itself. One thing that I found very interesting is there is sugar in it, and people say, well, I don't want to take a vaccine, it's full of sugar, I'm a diabetic. I don't know what, I don't want sucrose or corn syrup, or, you know, everybody has different things and beliefs and things they want to put in their body.
Put down the Diet Coke and donut.
Put down the donut, and then the sugar is literally basic table sugar. And the reason they have to do this, and I found this so interesting, was it is mixed into the vaccine because it helps the spike protein maintain its shape when it's frozen at 100 degrees below 0 centigrade. So that is super, super cold. And when things get that cold, they often will rupture. So between the lipids, the salts, and the sugar, it helps maintain that the right consistency and the right shape so that the protein doesn't get damaged, because a damaged protein isn't going to do anyone any good when they go to give the vaccine. So basically it's lipids, salts, and sugars. There is no preservative in this vaccine because there's no organic biological material that needs to be preserved. Now, in the Janssen vaccine, it's a little bit different only because it's a different type of virus. It still has salts and sugars. There's no lipids in the Janssen vaccine because it doesn't need to transport the protein into the cell like the mRNA. So it has something called, you know, a citric acid that's naturally going to help reduce any biological protein or I'm sorry, any biological growth or bacterial contamination. And there are other things in there included like ethyl alcohol, which is a normal component in a vaccine. Things that are not in the vaccine, heavy metals, mercury, thimerosal. There are no microchips. There are no veterinary tags. You're not getting a magnet. I've seen that one, the magnet. Yeah, those things aren't in the vaccine, but the products that are in there are required to be in there to make it a safe and effective vaccine. Just because we have a vaccine, now we need to have a way to get it into the cell so that it can do what it's supposed to do. It reminds me of that old movie in the 80s where the guy shrunk down and went inside the body. Like they have to figure out a way to get it. Just because we have it, we have to get it where it needs to go now to do its job. And sometimes those types of chemicals and things, preservatives, are needed to make sure things are safe. The amount of mercury in thimerosal it's not mercury like you would think of mercury as in like a thermometer or a fish. It's a it's a very low weighted mercury that prevents bacterial growth. So if you have a vial and you're going to take out multiple doses throughout multiple times, by having the mercury in there, the thimerosal, it prevents the growth of other bacteria that maybe the person at the end of the vial would be exposed to because you've poked holes in the top of this thing to draw out the fluid 10 times.
But for the record, that's not in these
It's not in
vaccines.
this. Sorry.
Those are in like multi-dose
Sorry, Melanie.
vials of like old flu vaccines.
Yeah.
And I don't think it's been used for several years.
No.
So, but
Right.
this does not have mercury in it. So another topic that we were asked to talk about were the variants, the COVID variants, and whether or not maybe we would have to develop other vaccines. And the answer is yes, we probably will. We expect viruses to mutate. So, like, again, COVID and the influenza are so different, but they're both viruses. And you can get a influenza vaccination and be 50% protected from influenza because there's so many strains, and 50 is actually kind of high, but there's so many strains of influenza that are around because influenza is such an old illness. COVID only has a few variants, but the more hosts, the more unvaccinated people this virus has to infect and mutate in, the more variants we're going to have. And the risk of not wiping out the virus through reaching herd immunity or 80 or 90% vaccination is that ultimately this virus, although our current vaccines are protect us from the variants right now, for the most part, the risk is that the more host it has to mutate, the more risk there is that it will develop into an even more virulent strain of COVID and be able to get past the vaccines that we've already made. And that's the case for any virus. Is that with enough unvaccinated people, you're going to have outbreaks, you're going to get mutant strains, you're going to have to make new vaccines. I know that Pfizer is already working on an updated vaccine, so that will cover some of the variants. So I'm not 100% sure when we'll have information on a booster shot or on a new vaccine, but it should be soon. What we do know about these vaccines as it stands right now is that they are pretty much the most effective vaccines at preventing the illness that they're targeting out of like any vaccine that's ever existed. And that is in large part due to the research that has been done with this technology for the last 30 years. Like, we've come such a long way. But we do expect more vaccine development against the variants. We expect to see variant strains. We expect them to become more virulent. And really the only way that you can truly protect yourself and your communities and your families from that is to get vaccinated, because your vaccination is protecting your kids that are too young to get vaccinated, your babies who can't get vaccinated through passive immunity, the elderly people who are most at risk, people who are on chemotherapy maybe and can't get vaccinated right now. There's a lot of people that we have a responsibility to protect as healthcare workers. And yes, your body and your choices matter a great deal. So just consider that getting vaccinated is demonstrating that you care about other people.
And we don't want you to get COVID.
And we don't want you to get COVID.
Because it's not cool.
Speaking from personal experience, I know a lot of people were like, I didn't really have any symptoms. I got pneumonia.
I got pneumonia.
I am a healthy 30-something-year-old person, so it can really affect a lot of people very differently. So just keep that in mind too. We've seen a lot of death,
We don't want to see that ever.
and anything that we can do to protect ourselves and each other, super important to do so. That, and Emily and I get to sit next to each other in this room with no masks on because we're both vaccinated. So we're protecting ourselves and we're protected from each other because we both got the vaccine. So let's strive to increase our vaccine rate. Our residents get it. They're 97% of our residents are fully vaccinated, which is awesome news. So I think only 66 or 67% of our staff are fully vaccinated, and we would love for that number to be higher.
Yep.
With the goal of 75, but of course, we know that it takes more than 75% of a population to develop that herd immunity. So it's closer to that 80 to 90%. So please, if you're on the fence about getting vaccinated, if you have other questions about it, if you want to know how it works inside of the cell.
Yeah, I've got a
We'll
breakdown
show
like
you
how it goes into the nucleus of the cell, and I mean, we have all that information available. And if you want to talk to somebody besides Mallory and myself, we can get you in touch with a pharmacist or one of the local infectious disease docs. They love talking about this science nerd stuff, and so do we.
So I just actually found some of my other questions, which I thought was kind of funny, questions that I got asked in the first Q&A. And some of these things I didn't know the answers to then, but we do now.
All right, what are they?
Well, those of us that get vaccinated have to get booster shots every year. And we know that booster shots are probably coming. I anticipate it's going to be more like tetanus, where you probably don't have to get it every year, but that's really dependent at this point on the rate of mutation of these
Yeah, we don't know.
variants. How long can you space out the first dose from the second dose? When is it too late to get the second dose? And that answer is still 12 weeks. So if you get them 12 weeks apart, you're still considered protected. It's recommended that it's under 6 weeks apart, less than. You really should follow the schedule, but if it's a barrier, just get both shots. Will Moral Home make the COVID-19 vaccine mandatory? And will the flu vaccine continue to be mandatory?
I can tell you, yes, the flu vaccine will continue to be mandatory. I don't know about the other one.
At this point, we don't think that the COVID-19 vaccine is going to be mandatory, especially not with an emergency use authorization. So no, at this time, we're not planning to make the COVID-19 vaccine mandatory. Will the COVID-19 vaccine info be available on Weir?
It is already available on there, yes.
Once you get the vaccine, are you still able to catch COVID?
Yes. At a much lower likelihood. So Moderna and Moderna and Pfizer vaccines, they rate about 94, 95% efficacy, which is amazing compared
Unheard of.
to a vaccine. Normally when we have the flu shot, like Mallory said, if we get 50% coverage, we're like, yay, or 60, holy cow.
We guessed right.
Yeah, so 94.5% is just unbelievable. There still is about 5% of the population who will get vaccinated and can still get COVID. And that, people have a lot going on. They have comorbidities or multiple illnesses. They might take a lot of medications. They may have cancer treatments or autoimmune disease. And those things all play a role on people's immune systems. And maybe they're exposed and 5 people in their household all have COVID. That's going to be hard to avoid getting COVID. The thing is, vaccinated people will have a less severe case than an unvaccinated person. And recently, I know I just told you this
The
statistic.
99.2 of all COVID deaths are unvaccinated individuals.
Yep.
That 0.8% of COVID deaths are likely from variant strains.
So daily, still daily in the United States, people are still dying from COVID. The rate is much less than it had been. And daily, I think, what did I tell you about? 500 people die every day and they're unvaccinated compared to the 3 or 4 people who die a day that are vaccinated. So when you compare 3 versus 500, that's just astronomical.
Also, just as an aside, it still takes 2 weeks after your second dose of a 2-dose series like Moderna or Pfizer, or 2 weeks after your 1-dose series like the Janssen, to be considered fully vaccinated. So that 95% efficacy, that you don't have that until 2 weeks after your second dose. So keep that in mind. Once you start your vaccine series, shot 1, day 1, you're not protected like that. So you can still get COVID, and it's not entirely unlikely for you to get COVID after getting 1 dose of a vaccine.
You're not getting it from the vaccine, but
Thank you.
sometimes what happens is people get their first shot and they go, well, I got my COVID shot. I can take my mask off at the grocery store or go to the casino with no mask and, you know, go hang out at the music festival. You're still not protected yet. It takes about 2 weeks, and that's with any vaccine. You know, that's your flu shot. So you could on day 3 be around somebody who has COVID, get COVID, and then you go, well, I got my COVID shot. Why did I get COVID? That happens a lot with the flu shot. Every year we have that you know, the way it's perceived like that. So just very clearly, until you're 2 weeks after your second shot, you're not fully immunized.
How bad are the side effects of the Moderna vaccine?
I mean, it depends on each person.
Yes, it does.
Mallory had a severe case of COVID. So her first vaccine was no good. She was very miserable because she already had a lot of antibodies from having COVID. I had a milder case of COVID, and my first vaccine, I didn't have any side effects, but my second one I did.
And my second one, I really didn't.
And she was fine after the second one. Every person's different. There are side effects. They lasted for me about 8 or 10 hours. I was tired. I wanted to take a nap. I had achy joints. I took some Tylenol and I took a nap. And then I woke up and I was okay.
Headache's the most commonly reported side effect. You're also potentially going to see low-grade fevers, body aches, chills, and it's going to be very short-lived. But one of the most amazing things about having those somewhat minor side effects is that the COVID virus itself actually can change the structure of your organs. It is pervasive throughout your entire body. The COVID virus affects your neurological system, your cardiovascular system, your GI system, as I can attest to, because now I have heartburn after having COVID, which I never had before, and I refuse to believe that it's from getting older. So, but it's pervasive and it affects all of your body systems. The vaccines doesn't do that. It doesn't alter any kind of your DNA. It doesn't change your organs. It just stimulates your immune system. And so you might not feel super great for the day after, but that's nothing compared to the risk of what getting that virus can do to you. So just as an aside.
It's interesting to me, on a chest x-ray of a COVID patient, they actually say like COVID lung because it looks so unique. It doesn't look like a typical pneumonia or fluid on your lung. It has this very strange, like
Broken glass.
it looks like broken glass, but it also has like this, you know how leaves have all those like veins in them? It has its own term because it's not something we've seen before. Spider webbing, that would be a good, like broken glass with a spider web on it.
And now we're even running into these COVID long haulers. We've seen that as a diagnosis coming into our facility of people who get COVID and they just can't recover because it has impacted every body system. So just all things to keep in mind. Again, if you have, I don't think we have any more questions to go over. But if you guys have any questions, if you guys want to see any of our visuals, go over anything more in depth, more specific. We can't really go into the mechanism of action of the mRNA vaccine inside of the cell and how it's dispersed throughout your body and whatever in this clip because we want people to keep watching and not lose interest. But if you want to know that, come find us and we'll explain it to you.
Or find you a cool video.
Yeah, or we'll find you a cool video. There's like lots of cool videos. So, and we'll do our research and make sure they're from reputable, credible sources.
Yes.
We will not pull it off of Facebook.
If you decide that you are interested in the vaccine, doesn't matter, Moderna, Pfizer, or Johnson & Johnson, you can let me know and I can help coordinate that appointment for you. We can have the county come right here. You can have it done right at work. You can go to the county, you can go to your doctor's office, you can go to a local pharmacy. We do ask that if you are vaccinated, you do let me know so that I can update your medical record here at the Moore Home.
And that information is protected. So if you get vaccinated, your name's not like on a list somewhere where all the staff can see it. It's in a private file that Emily, as the infection control nurse, has access to, and that your supervisors have access to. But that's it. Other than that, it's your choice to share with other staff whether you've been vaccinated or not.
The other benefit of being vaccinated is after you're fully vaccinated, you don't have to be tested anymore on a regular basis.
Also cool. So if there is a COVID outbreak, you would have to get tested. But the more vaccinated people we have, the less likely that is to happen.
Yes.
So thank you guys for submitting your questions. Thanks for watching. I am going to post this to our YouTube channel. If you don't have anything else, I guess we're done for the day. If you do have anything else, please shoot us an email, ask, talk to us. We want to talk to you. We want you to be informed, and we want you to be able to make the best decision possible for yourself and for our residents and families. So, all right.
Bye, guys.
That's it. Bye, guys.